and welcome to The Art of Aging, part of the Abundant Aging podcast series from United Church Homes. I'm Beth Long-Higgins, director of the Ruth Frost Parker Center for Abundant Aging, and it is my joy to be able to host this conversation today. On this show, we look at what it means to age in America and in other places around the world with empowering conversations that challenge, encourage, and inspire us all to age with abundance. Our guest today is Dr. Leonardo Marchini. Leo is professor and chair of Preventive and Community Dentistry at the Iowa College of Dentistry and Dental Clinics. He is also president of the Special Care Dentistry Association. Leo teaches predoctoral students in the geriatrics and special needs program and treats patients in the faculty general practice. He also acts as a general practitioner with an emphasis in geriatric dentistry. Leo's current research focus includes geriatric dental and general health epidemiology and satisfaction of prosthodontic patients. Did I say that right?
You did.
Okay. Leo's also interested in researching about the best way to teach dentistry with particular interest again into geriatric dentistry teaching. Welcome, Leo.
Thank you very much, Beth, for this wonderful introduction. I'm not sure if I deserve all that, but I am happy you did it.
Oh, you deserved all of it. Just look at the certificates behind you on the wall.
Thank you.
I want to start here, Leo, by you just sharing with us a bit about your background. You've chosen to specialize your career in dentistry and what you describe as special care dentistry. Older people, people with disabilities. Why did you choose to focus your talents in this area? And this is an area I didn't even know existed.
Yeah, it was very interesting because that happened during my journey in dentistry. So once I graduated from dental school, I always thought that I would like to teach. And I start by teaching prosthodontics, which is teaching dental students how to fabricate artificial teeth. So dentures, either partial or removable, or partial or complete dentures, crowns, bridges, over implants. And I started teaching specifically complete dentures, which are, the regular complete dentures that are still used today. And at the time I started doing that 25 years ago, that was primarily done for older adults. So we will have a cohort of older adult patients at the time. And I started gaining more interest in learning how those patients get used to dentures. What were the factors that were dictating their satisfaction to their dentures? So how could we improve the way we fabricate, the materials we use, and all that to get a better patient satisfaction? During that process, I started understanding a lot of the context that is around getting old, being old, aging, and how that influences multiple aspects of people's lives, including those related to oral health. During that process, also, a new cohort of older adults come into play, adults that would not need complete dentures anymore. They are keeping their teeth for life. And now we are not only able, but we need to understand more complex oral health care needs of those older adults who at the same time are more medicated than ever, have more chronic diseases, and are living for longer periods of time. So what was initially something very niche, very specific, become much more complex, much more entailing, and requiring a much more broad spectrum of healthcare disciplines to get involved. So interprofessional care came into play, discussing patient medications with pharmacists and other prescribers, as well as understanding some specific areas of their general health become more important. And as it become more complex, I start reading and learning more about it, and also dentists and dental students start looking for more information about it. So I start teaching it. And then we started also noticing that our geriatric and special needs clinic, which initially were predominantly composed by geriatric, or we call geriatric, those frail older adults. Those adults that are aging gracefully, they don't need as much our help. They would be seen by their general practitioners, given that those general practitioners have a little knowledge about their medications, possible impact in their oral health, and know a little bit about their chronic diseases. But those more frail, those are our focus. But in our clinic, that cohort started to change too, and we start seeing more patients, more adults, young adults with special needs too. So adults with autism, with Down syndrome, with cerebral palsy, that were able to thrive throughout their childhood and adolescence, and now are being seen in our clinic, right? So, and that, of course, we start seeing that those families have a really hard time, both for frail older adults and adults with special needs, to find providers in the community, because dentistry was not preparing graduates to care for those populations. Well, there was, in fact, a few decades ago, as we have discussed, the need was not there. But now the need is becoming even more evident, and therefore we are offering that that learnings to our graduates and for postgraduate students too. And as you know, we start seeing how the families are grateful and how rewarding it is. It becomes a passion, right? It becomes more than just teaching and learning and all that. It becomes really something that we do with a lot of love and care.
Yeah, that's fantastic. I was just, as you were talking, thinking of a dear friend of ours who lived with Down syndrome, and he lived well into his 60s. And I realized, through his family, that was an extraordinary longevity for him, and that folks are living longer with these conditions, which usually resulted in shorter lives. So yeah, very interesting. Very interesting.
Correct. And Beth, what's nice is that this is an achievement of humankind.
Yeah.
Right?
Exactly.
It's the apex of our civilization. We are able to care and provide a meaningful life for those individuals for a longer period of time. And for that to happen, we need a lot of care coordination. We need a lot of people involved. And oral health is part of that team.
Yeah, absolutely. So let's just take a step back for just a second. And would you explain to us, I found this really fascinating when we were talking, what is the state of oral or dental care for older adults today? And for instance, why does Medicare not cover dental?
Well, that's a wonderful question, Beth, and thank you for asking that. Well, let's start with the first part of the question, right, which is what's the state of oral health for frail older adults now, currently? So now, when you look to any report, almost anywhere in the world, oral health for frail older adults, especially those more vulnerable, by vulnerable, usually we are talking about those who are living in long-term care institutions or are living still in the community but homebound. So for those two groups especially, oral health is always poorer if compared to their counterparts with same age, right? So for frail older adults, especially those who really require a lot of help, that we call the functionally dependent frail older adults, those are the ones who usually you have poorer oral health. Well, Leo, what's poorer oral health? Well, poorer oral health means more cavities, more gum disease, more oral lesions of different kinds, including oral non-diagnosed, more advanced oral cancer lesions. That's what it means. Unfortunately, that population many times can't seek care for their own, right? I mean, they can't express pain, express discomfort because of their cognitive abilities. And many times, even if they can do that, they don't have the mobility because they have physical disabilities to seek care on their own. So as they are dependent on that, they become more exposed to not having a dental home, not having regular care. So this oral health among these groups usually poorer. Well, there are many reasons for that. Some are, as we said, related to the person, right? Related to the fact that the person has a disability that can impair cognition, that can impair mobility, that can impair access to care. There are barriers that are related to the profession, to us dentists, that we don't have enough dentists that have the knowledge to care for that population, because there are few dentists who had advanced training in that area. Some others are related to the social context, right? Which is the family being able to provide care? Is the institution providing the care, the oral health care, among other necessary points of care? Is there a transportation for that to bring them to the dental office? And finally, the finances. As we know, those families are usually under extenuating finances conditions, right? Financial conditions. Why is that? Well, because they need to provide all the other general care. They need to provide nursing care. They need to provide medications. They need to provide a home, institution. And as we know, in our health system model, dental care and dental insurance is related to employment. So for both our focus populational groups, I mean, frail older adults and adults with special needs, employment usually is not part of the picture. So they don't have insurance, meaning that they would need to pay out of pocket for dental care. That's a huge barrier. Some states do provide Medicaid coverage for adults and frail older adults, for adults with special needs and frail older adults. However, that coverage changes through state lines and changes also with the political winds, right? So that's another piece of the puzzle where you can start seeing a more important influence of the political landscape, of the social landscape into this specific type of care. So here in Iowa, we are very fortunate to have a Medicaid program that cover adults with special needs and cover frail older adults and provides comprehensive dental care to those groups. So we are a large Medicaid provider. So this is a very fortunate circumstance. However, even in a state that has this fortunate circumstance, reimbursement might also play a role. So, some providers in the community may not take Medicaid patients because of the level of reimbursement rates, which is unfortunate and have multifactorial origin. But fortunately, here in the college, we are able to accept and provide comprehensive care for those patients. Now, why Medicare doesn't have dental coverage has also historical roots, right? When Medicare was established for people who would get to 65 first, not a lot of people will get to 65 at that time. So, when the calculation was done, the budget would be for a small fraction of the population that will get to that. Well, currently that trend has reversed. So putting the budget under more pressure, and of course, adding anything to that already pressured budget is complicated. So I think that's the root cause of it. But of course, there are how do people say, when there is a will, there is a way, right? So yeah, it all depends on our society, right?
Yeah, absolutely. It's, this is just a perfect example to be able to talk about how we age within systems, and the policies and the legal structures around us affect how we age. This is just a perfect illustration of that. So as we've been talking about increased lifespan for many of us. So what do you see for those folks who are living into their late 80s, 90s, centurions? What changes happen within our mouths?
Very good question, Beth. Very good question, because that has at least we can answer this question in two main layers. Let's talk about the changes that happen without disease. And let's keep in mind that this is very rare, right? 90% of adults across the globe will experience caries, right? Cavities sometime in their lives. 90%. Right? So it's the most prevalent chronic disease in the world. Most prevalent chronic disease in the world. And I would add most prevalent chronic but preventable disease in the world. But we'll get there. So let's take that out of the picture and say that the person was able to prevent caries and periodontal disease and is aging gracefully. Systemic health-wise, same thing. They're being able to stay healthy and active and a good diet and all that. What would happen is the teeth get more yellowish, right? So currently there is frenzy around whitening and doing all that, which, we understand that's depicted this way in the media and all that. Older adults, we usually have naturally, with good aging, yellowish teeth as compared to themselves when they were younger, right? Because the way it is. It becomes more yellow. Also, during our lives, we chew and we also grind our teeth every now and then during our lifespan. More, some people do it more, some people do it don't do it as much, and but we will have some degree of attrition. So you're going to see a little bit of leveling of the teeth, right? Some when that's a little bit more pronounced, you can also see kind of small lines in people's teeth, right? We call that crazy lines, right? They don't necessarily need treatment. They should be inspected by a dentist regularly, but most of the time they don't require any treatment, right? The gums can present with a little recession, meaning that a little bit of the root of the tooth can become visible, right? So that would also be seen as a normal result of aging. And our mouth scheme will get a little bit more fat tissue, so we're going to see a little bit more small yellowish points in the mouth scheme, right? But that's totally normal, doesn't bring any trouble and all that. So that's normal aging, right? Without disease. But what really happens is that people get cavities and then they need to extract teeth, and then there is also periodontal disease. Our diet is rich in sugar. Sugar is the food for the bacteria that would destroy the teeth. So what happens is people would, as they age, they are more exposed to those factors, and therefore they start losing their teeth. With losing their teeth, their bites start to collapse. You're going to see, the chin getting closer to the nose and reducing the height of this lower third of the face. So when you look at people's profile, you're going to see that chin getting close to the nose, which in old times would be called, well, in our jargon, we call it reduced vertical dimension. And that means that people start to get more wrinkles around the lips, especially this wrinkle here. And there is that really stereotypical old face, right, when that happens. And why it's more common to have that type of visual appearance when we age? Well, because it's more common to age with some oral health disease still. Okay. Right? This cohort is changing it. Baby boomers are getting in droves at retirement age, and baby boomers will change that paradigm, because what will happen is they will have most, if not all, of their teeth.
Yeah. So as I'm aging, I shared with you, I have my first cavity at the age of 59. I almost, so I've joined the 90%. And I was, so some things I've learned along the way. It was really shocking to me at the age of 26 to be in the dentist chair, and for her to say, the hygienist to say, Beth, just so you know, when the dentist comes in, they're going to probably talk about you having braces. And I almost started to cry. I said, I've had braces twice already. That was a planned 2-phase thing. And she said, well, your jaw can start to retract, shrink in your 20s. So I did braces again for the 3rd time. And so I am a baby boomer who is aging, and I wear a retainer. Not every night, but most nights, So I'm pretty sure previous generations, as we age, didn't come to the dentist and say, can you clean this for me?
Right. This is an awesome example of access to care, right? Yeah. It improved in a generation time, right?
Yeah.
I mean, you were able to to access really, a specialized care, and letting alone having those frequent recall appointments with the dental hygienist, with an exam from a dentist every 6 months or every year, right? That we're able to keep your dentition for the whole life. Of course, you did your part of it too, right? Controlling the diet, brushing your teeth, flossing, and all that. But a lot of it has to do with fluoridation of the water,
Absolutely.
right?
Yep.
So
Yeah.
we have that as a benefit to almost, the entire population. And and you just highlighted how important it is to have access to care, right? To have access to the dentist, to have access to regular care. You had a dental home, right? Where you were regular. The dentists know you, you know the dentist, you know the dental hygienist, the dental hygienists know you, know your habits, know how to talk to you about, changing habits to improve outcomes and all that. Unfortunately, that's not evenly distributed in our society yet, as we
Absolutely.
were discussing.
Yeah.
So, many times what happens is that the poor, right, will not have that same level of access. So there is still a trend where you can see that the people that now are getting old, losing their teeth, are only those with reduced economic means, right? I mean, edentalism, which is losing all the teeth, has become restricted to some geographic areas where
Mhm.
poverty is more ingrained, right?
Yeah.
So,
It, it,
edentalism is rare among middle class and wealthy families, but it is still a thing among the poorest.
and not even economic factor, but is there a relation? I know that there are many parts of the country. You said Iowa is one of these, where there are counties that don't have dentists, and so if people to receive dental care, they have to travel long distances. How does that affect the longevity and the health of those individuals who just don't even have access to dental care?
Right. Beth, you are absolutely right. That is another important factor. And this important factor is intertwined with the other one, right?
Right.
Because
Right.
usually the more affluent, as soon as, families get more affluent, they will leave those areas where there is no care, where there is no access to cultural, things, where there is no access to the goods and services that they are looking for. So, they are intertwined, but of course, they are intertwined in a bad way, they are intertwined in a good way. If we can provide those services, then it will be a driving factor for people to populate those areas. And so many times it can be a vicious cycle, and if we take the right measures, it can become a positive cycle.
Right.
And and then we can have that. But oral health deprived areas, right, areas where we don't have enough practitioners to provide care for the population, are a real issue. Those are dental deserts, if you will,
Mm-hmm.
right? Where people don't have a dentist. They need to drive 1 hour, maybe two, to get to a dentist. And when you look at frail older adults, those are more.
Yeah.
Those are even larger areas because, to obtain the care that is age appropriate for them, their local dentists may not be able to do that. So they will need to travel even further to get that age appropriate care.
So let's talk about some practical tips that you might have for our listeners. What things should we be looking for that support us as we age in terms of our own oral health? So for instance, should I be looking for different things in my toothpaste?
Yes, you should. You should always be looking if your toothpaste has fluoride on it.
Okay.
That's by far and large the most important piece.
So we need that fluoridization our entire lives. It's not just when we're kids.
Oh no, Beth, I'm so glad you said that because that's a very, very, very important misconception. No, that topical fluoride that we apply topically to our teeth, like the fluoride on the in toothpaste, the fluoride on a rinse, even the fluoride that is in the water fluoridation. It is very important to have that throughout the lifespan. Because this is a dynamic process. Okay, our teeth will lose minerals and gain minerals from the saliva all the time. So if fluoride is there, they will gain fluoride from the saliva. Fluoride will strain your teeth throughout your lifespan. And then that fluoride that's strengthening now may be lost tomorrow, but then you have exposure to fluoride again, you regain it. So, you need to keep that exposure all the time, forever. So, good question. Excellent point. So the first and most important thing in a toothpaste is, does it contain fluoride?
Okay.
Everything else is less important than that. But of course, if you have sensitive teeth and would like to use a toothpaste that is desensitizing for you, like, some people need, well, that's totally fine as far as it's desensitizing, but does have fluoride. Fluoride is the key ingredient there for us. And I would always say, find a toothpaste that you like the taste, right? A fluoridated toothpaste that you like the taste, because then you are more likely to use it. Another important piece is a pea-sized amount. That's all we need throughout our lives, a pea-sized amount. We don't need that huge, amount of toothpaste in our toothbrush. Pea-sized amount.
Okay. Another practical tip from you. What would you suggest? How do I establish a better relationship with my dentist so that I can be better supported in my future self? So I will be going to the dentist in 2 weeks. For the last time, I will be telling them goodbye because they're no longer supported by my dental plan. So I'm going to be looking for a new dentist. I'm now over 60. Are there some particular things I should be thinking about as I'm looking for a new dentist in this period of life?
You are an adult that is aging very gracefully, Beth, especially in regards to your health, thanks God, right? And your care. And also, your oral health, as you have pointed out earlier. So, a general dentist in the community that, a friend and the community regard as a good dentist will be a great fit for you. They will be taking good care of you. They would be able to do exams I would say, ideally every 6 months, have a cleaning and an exam, and every year get a few set of x-rays just to keep things on check. It's all that you need. What we need to be very attentive is not as much as to persons with your characteristics, because although you are part of the majority, the real problems happen to people who would were doing exactly what you are doing, and having the care that you are receiving, but then all of the sudden they get a stroke, or they are diagnosed with Alzheimer's, or they have a diagnosis of Parkinson, or they start having real issues with their hands because of arthritis. Okay, well, of course, people that would have those problems, they will not go to a dentist. They are going to go to the provider that will care for those issues, right? So especially, like, say, a stroke, they go to the emergency room, and then they will see a group of people, but usually led by a neurologist, right? And they will get all that care and all that. And there is a lot of things going on, right? Housing, finances, how they're going to do dressing, how they're going to do bathing, how they're going to do, how they're going to take care of their daily lives. Well, and of course, one thing that fall through the cracks is the dentist, the dental appointments. Understandably, they have a lot on their plates. They're doing a lot. But it would be awesome if the provider who, is taking care of them, of course, there's a lot on their plates too, but they have a protocol. They're going to say, you need, a week here in the hospital, then 2 months in the rehab center, then you're going to need physical therapy, occupational therapy. At home, you need to have those adaptations or this or that. But among these laundry lists, there is no dental appointment in there most of the time. And that's a problem, because it would be awesome if there is one line there saying, as soon as possible, contact the dentist to see if a special oral health care prevention routine needs to be established. Because that person, of course, if the person is not able to take a shower, they probably are not also able to brush their teeth. But see, when you are in your routine, you may be like myself, before I take a shower, I will brush my teeth. That's a daily routine. I do that every day. So one thing triggered the other. Well, the person who had the stroke will not be able to have a say on that. And the person who is helping the person who had a stroke will not remember that. It's not, they're busy enough trying to give them a shower. Letting alone, being reminded that they need also to brush their teeth. But if they go to the dentist will help them establish a routine for that. And it's a similar thing when they get a diagnosis of Alzheimer's. They will get a lot of tips about different things, especially, ways to avoid them wandering around and all that can put their lives at risk and all that. But maybe if there is one line on that list to saying it would be great to contact the dentist to establish, an oral hygiene routine for a loved one, great. They are going to do that, right? So they are going to go to the dentist. The dentist will be able to check out what the patient can do, cannot do, who can help, who cannot. We'll figure that out among, with the family, with the caregivers, and come up with a plan. A plan that may include, instead of 6-month recalls, maybe 3-month recall, or maybe 4, or maybe even the 6. But they will be able to say, well, now instead of using any toothpaste that's fluoridated, you're going to use a high fluoride toothpaste. That's a prescription one that we're going to prescribe for you. Once a day or once every other day, whatever, the need is, please check on mom to see if she is brushing at the time she's supposed to be doing it. Please check the amount of toothpaste that has been used after a week, right? Or please remind mom in the evenings to brush her teeth, and then the dentist will be able to provide a nice, straightforward way to keep track of it. That can be, night and day as having no problems with oral health on top of all the other issues, or having oral health as, a big problem on top of all the other problems. So it is the key in our profession, in my profession, that is prevention. Yeah. The most important dental diseases by far, which is caries first, periodontal disease second, they're preventable. They can be prevented.
So what do we need to think about then in terms of when a loved one has to go into a nursing home for long-term care?
Oh my gosh.
Does the dentist come to the skilled community?
Oh, Beth, now you touch the nerve. This is a really good question, Beth. The answer for that is yes and no, meaning that some dentists in the community will come to nursing homes and will do some care. Some other dentists will have an arrangement with the nursing home, and the nursing home will transport people to their facilities. But most common than not, the nursing homes will have a dentist on file because that's mandatory. Okay, but they will not have a regular procedure. They will not have a regular routine for two things. They will not have a regular routine for dental care. Many times, nursing homes don't have a regular routine for oral hygiene. And they also don't have a regular routine for oral health care, meaning, bringing residents to the dentist regularly for regular checkups. So when you are looking at a nursing home for a mom or dad to reside, it would be really good if you can ask, what is the dental plan? What is the usual regular routine? Mom has Alzheimer's. She will not be able to brush on her own. Would the nurses help? Have them been trained? Right? Mom will need to see the dentist more often than a person that doesn't have Alzheimer's, right? A person that doesn't have dementia. So, would you guys be able to bring mom every 4 months to the dentist? And then contact mom's dentist too and say, hey, who does that, Beth? Who does that? That doesn't happen, right? Contact mom's dentist and say, hey, doctor, you have been mom's doctor for those many years. Now mom's going to a nursing home. I want to tell you that. How can we keep her dental care? Do you want me to bring her? Do you have an arrangement with a nursing home? Or do you want to refer me to someone who does? Ask the question. Be the advocate for your loved one, right? ideally, you should not have to, because, ideally, the systems should be such that the medical provider will give you the guidance, right?
Yeah.
The nursing home will give you the guidance. But reality is, it usually doesn't happen. So, and also, and mea culpa, mea maxima culpa, right? I mean, also the dentist should be, well, Mr. So-and-so has not been here for an appointment in a year. He was a regular. Let's call him.
Mm-hmm.
And if he doesn't answer the phone, let's talk to his wife or his daughter, or because many times they are all patients.
Mm-hmm.
Okay, of course you should not break HIPAA concerns there, but you might be able to ask, is there something going on? And most of the times people will be upfront, will say, oh yeah, I know, Mr. So-and-so has had a stroke. Oh my gosh, would be wonderful if he come for a visit, because it's really important to prevent oral health issues from happening, So the dentists also play a role in not establishing a routine care.
This has just been a great conversation, and we are going to continue on another podcast. So I'm going to bring this one to a close. Thank you so much, Leo. Before we had our conversation, I had never even thought about dentistry in terms of how it affects longevity. And there are just so many other questions I could ask. We could talk for a very long time. But as we bring this to a close, there are a couple of questions that we ask our podcast guests. So I'm going to ask you a couple of them now. You ready?
Yes, I am, hopefully.
Okay. When you think about how you have aged, what do you think has changed about you or grown with you that you really like about yourself?
Oh gosh, it's hard to talk about ourselves, isn't it? But let's try. I think the thing that I like most about aging is that as we age, we can accumulate experience. And there are certain things, there are certain topics and certain matters, certain themes that you can only really learn about and understand fully with experience, by having that experience, by passing through that circumstance, by being there in that moment. Even if you read a lot, even if you study a lot, still nothing will replace that experience learning that only happens with aging. So I hope that I was able to get as much as possible from all those experiences, and I now know better how to deal with those sets of circumstances. So I think maturing in that regard is a very good thing that comes with aging.
Nice. Okay, here's the last question for you. What has surprised you the most as you have aged about yourself?
Oh my gosh, well, it really struck me some changes in my body, in my physical form, in the some conditions that are due to repetitive movements and so are related with time, right? That will not be a thing for a 25-year-old, but are a common thing for a 50-year-old. Those are the things that we don't think about when we are 25, 30, but now they can impact my routines. And when that happens, that really gets me, and I would love to have been more thoughtful about them when I was younger, to either postpone the consequences of it or avoiding entirely the consequences of it, and that now I need to deal with them medically. And thanks God, medicine has evolved, and we have wonderful physicians that can help us. But yeah, that is the part that I think to some extent could have been prevented, or at least, as I said, could have been postponed, but are not as pleasant, I would say.
Well, as we say, aging is cumulative. And so,
Right.
and back to your first answer, there are just some things we don't know until we are older.
Right.
Yeah.
But for sure, aging is better than the alternative.
Exactly.
That I can tell for sure.
Exactly. Well, thank you, Leo, and thank you to our listeners for listening to this episode of The Art of Aging, part of the Abundant Aging podcast series with United Church Homes. And we want to hear from you. What's changed about you as you've aged? What's changed about you that you love? What surprised you the most? I invite you to visit us at www.abundantagingpodcast.com to share your ideas. You can also give us feedback when you visit the Ruth Frost Parker Center website at www.unitedchurchhomes, all one word, .org/Parker center /. And when you check out that website, if you're still listening to this in the month of September, check out our symposium, which will be happening on October 6th, where we will be talking about how to dismantle ageism. And Leo, tell us again, where can people find you, and tell us about the organization, the special care dentistry.
Yes. Well, first of all, I want to express my gratitude to you, Beth, for the wonderful questions, for welcoming me to the podcast, and to your wonderful team that are behind the scenes making this happen. So thank you a lot for that. Thank you for our listeners, right? The listeners, you are the reason for us to be here. So thank you for listening. You guys, anyone can find me at the University of Iowa College of Dentistry and Dental Clinics. I am the chair of the Department of Preventive and Community Dentistry. My email is leonardo-marchini, MARCHIN as Navy I, at university, right? Iowa.edu. Please, if you have any questions or concerns, you can direct the questions to me. And if I cannot, that can be cut later. I want to make a really quick pitch. We are fundraising for the Geriatric and Special Needs Clinic here at the University of Iowa College of Dentistry and Dental Clinics. We have a very lofty goal of raising money to improve even further our operations and being able to perennially, forever take care of the population that we care for. So if you are inclined to donate to this cause, please do not hesitate to contact me, and I will connect you with the University of Iowa Center of Advancement, who would be collecting donations of any size. So thank you very much.
Thank you. Thank you very much, Leo. Blessings.